people asked me to talk about topical dutasteride. So in this video, I'm just going to go ahead and provide my 2 cents on topical dutasteride. You probably already know what dutasteride and finasteride are. These are 5-alpha reductase inhibitors. They're going to lower dihydrotestosterone, and they're going to prevent progression of male pattern hair loss. These two molecules, for the most part, are incredibly safe, and clinically, I would argue that they're the most effective treatments that we have for male pattern hair loss at the present moment. Now, the problem with these molecules is that there is a significant increase in particular side effects, specifically sexual dysfunction. And the literature estimates that anywhere between 1 to 15% of individuals who use finasteride will experience some type of sexual side effect. Now, for the vast majority of people, this type of side effect is reversible, but there have been very rare reports of permanent sexual dysfunction and other psychological problems like depression and anxiety that has been called the post-finasteride syndrome. And although this side effect is incredibly rare, given that hair loss is a cosmetic condition, I think it's understandable that a lot of people would want to avoid lowering dihydrotestosterone in the entire body. This is where something like a topical treatment would come in. Now, a topical treatment is a more targeted treatment. It's kind of like a predator drone, right? If you're trying to eliminate a terrorist target, you can use a drone strike and just eliminate that target and not touch anything else. It's probably going to be better than dropping a massive bomb on the whole area and having all of these civilian casualties. So the topical treatments, the purpose of them is to lower dihydrotestosterone in target tissues. So in this case, we're talking about the scalp and the hair follicle without touching dihydrotestosterone in any other parts of the body. Now, topical finasteride has been studied fairly extensively at this point, and it looks like it's effective, it's efficacious at preventing progression of male pattern hair loss. However, it also looks like it gets into the bloodstream and it lowers dihydrotestosterone systemically. So in that case, what's the point of using topical finasteride when it's going to do the same thing as oral finasteride? And oral finasteride is, cheaper, it's more convenient to use since it's just a pill. Pretty much any doctor is familiar with it. It's just much easier to use. So this is where topical dutasteride comes in. And the reason why people are excited about dutasteride has to do with the size difference between the two molecules. The size of molecules are measured using a unit called Daltons, and finasteride, it's got a molecular mass of 372 Daltons versus dutasteride, which has a molecular mass of 528 Daltons. And this is significant because theoretically, dutasteride should have a more difficult chance passing through all the different layers of skin and winding up in your bloodstream and circulating throughout your entire body versus finasteride, which is a much smaller molecule. And basically, there's a rule called the 500 Dalton rule, where molecules that are smaller than 500 Daltons are typically able to pass through the skin, whereas molecules that are larger than 500 Daltons have a more difficult time doing this. And this rule comes from an observation that was made in a study from 2000, where they took a look at all of the different allergy-causing molecules. So these molecules would need to pass through your skin and interact with your immune system. They also took a look at all of the different topical drugs that are currently used, like topical testosterone, topical estrogen, topical fentanyl. These are, molecules where you apply the gel to your skin and it gets into your bloodstream. So all of these molecules tended to be smaller than 500 Daltons. On the other hand, when drug manufacturers tried to develop topical treatments with molecules that were larger than 500 Daltons, for the most part, these treatments were ineffective. So based on these observations, you can make an argument that dutasteride is probably not going to get into your bloodstream. So this molecular property has, an upside and a downside, in my opinion. The upside, it's probably not going to get into your bloodstream. The downside, is it going to get into your hair follicle to any significant extent? Is it going to lower dihydrotestosterone in this tissue? And at the end of the day, is it actually going to prevent progression of male pattern hair loss? And the issue that I have with topical dutasteride is that there are no human studies, like high quality human studies that have been done on this type of treatment before, right? So we don't know, what's the dosage, what's the formulation, what's the application frequency, like what type of topical dutasteride can you use that's going to effectively prevent progression of male pattern hair loss without lowering dihydrotestosterone in your bloodstream. There's just a lot of unknowns about it at the moment. There have been studies done on dutasteride mesotherapy, which is Essentially, you just inject dutasteride into the scalp. And the problem that I have with dutasteride mesotherapy is that for most people, it's going to be too expensive. It's going to be inconvenient. It's going to be invasive. Some participants in clinical studies did have pain from the injection. And it looks like a therapeutic dosage of dutasteride mesotherapy actually does lower dihydrotestosterone in your bloodstream and also alters sperm parameters to a similar extent to someone who's taking oral dutasteride. And then lastly, in a lot of these studies, they had, some kind of proprietary formula. It wasn't just dutasteride. They'd also include like biotin and certain B vitamins and other ingredients that are potentially active. But at the end of the day, what's the point of using dutasteride mesotherapy when, to get a high enough dosage to actually have good hair outcomes, you're going to end up lowering dihydrotestosterone in your bloodstream? You may as well just take oral dutasteride, in my opinion. Before I continue, I'll just mention, so Derek made a video about this from More Plates, More Dates. It looks like some of his viewers who use topical dutasteride do in fact have good hair outcomes without lowering dihydrotestosterone in their bloodstream. So that's something to note. These are anecdotes, but that is something that's interesting. And it also looks like Matt from Matt Dominance, he also advocates for topical dutasteride as well, and he's running some kind of pseudo study on the efficacy and safety of topical dutasteride. So I'll just note that because these are pretty prominent figures in the hair loss community that would definitely have an educated opinion about the matter. But as always, I would need to see real, hard clinical outcomes before I could recommend topical dutasteride. The human body is very complicated. Like I've said before, it's essentially a black box. And although, it's interesting that dutasteride is larger than finasteride, you wouldn't be able to use this molecular property to say, well, then dutasteride isn't going to get into the bloodstream, because you really don't know if dutasteride is going to get into the bloodstream until you run a study where you have a certain number of people who apply it, and then you measure the amount of dutasteride and the amount of dihydrotestosterone in the bloodstream afterwards. So again, I would need to see, preferably some kind of randomized control trial evaluating certain hair parameters like thickness, density, cosmetic appearance, etc. And then also looking at whether or not dutasteride actually does get into the bloodstream over like a year time span, I would say, but before I could recommend topical dutasteride. But I will say that compared to some of the experimental research chemicals that people are using, like various antiandrogens, I think topical dutasteride would be safer than those treatments just because dutasteride has been studied in a systemic context, right? People that take oral dutasteride for hair loss or for prostate enlargement, for the most part, don't have too many side effects with this therapy and tolerate it very well. So if you were to use topical dutasteride and if it got into your bloodstream, you probably wouldn't notice it, to be honest. So thank you guys for watching. I appreciate it very much. I hope this video has been informative for you. If you live in Toronto and you're looking for a drugstore, I'm opening a store with a couple colleagues. It's going to be located at 1703 Victoria Park Avenue in the medical building at that address. It's anticipated to open early to mid-September, so just look out for that drugstore when it comes up. And if you're looking to fill prescriptions or if you have questions about your medications, you can feel free to visit us at that time. So thanks again for watching. I'll see you in the next video.